Come on, Representative Porter. This is ridiculous. I mean, come on. Enough is enough. Why can't we have one uniform, universal voice about how we're dealing with these things?
I totally agree. The medical services charges here are ridiculous. There's no way that $2,000 charge is outrageous. So I very much hope you've appealed to your insurance company. I hope that they're not asking you to pay this, but I also hope that providers are not gouging insurance companies during this time. So once again, I think the way to approach this, and the way I hope we approach it when it comes to a vaccine, for example, is that when we say free, we mean truly free.
And Laurie, what about this $3,000? Who's paying for this?
Well, we're not. I've already met my deductible. So the insurance company is aware that these charges should not have been sent to them, and they're in the process of working that out with the hospital.
Wow. Somehow we got to bring some calm to this.
The problem is that we're not having clear enforcement from the administration. And I see this all the time. It is not enough for us to make a law. It is enough for us to make the law happen in real people's lives. And we're clearly falling short of that mark with regard to COVID. So I'm not done fighting on this.
Well, thank you so much for your fight. I want to bring in Matthew Eisenberg. He's a health economist and assistant professor of health policy and management at Johns Hopkins. So, I mean, you heard this. This is outrageous. Insurance companies are getting billed for COVID tests and other tests, $3,000. Patients don't know they're being billed for it. What is going on?
The way the charges are set up is individual providers are allowed to set their own charge and work with the insurers to negotiate a charge for the COVID test. And some research done by my colleagues here at Hopkins found that providers are charging insurers wildly different amounts for a COVID test, depending on the provider. But one thing Laurie said that I want to point out, you're absolutely right. Even if you don't get a bill, even if your insurer is going to cover the high bill, we should all still care about high bills because they're ultimately passed on to everyone through the form of higher premiums. So even if you're not paying out-of-pocket costs, we should still care quite a bit.
Absolutely. Well, Laurie, you heard it first. So, Laurie, thank you so much for sharing your story with us. We hope that others will realize, check your bill, and if it's a problem, push back and question it. At the end of the day, we all have to pay for this. And so, you know, at the bottom guy at the end of the day ends up paying for it in one way or another.
Exactly. And I think when the providers come up with the fees they're going to charge people, right, it can sometimes be broken down into a facility fee versus a doctor fee. And sometimes when you receive the same care at a hospital-based clinic versus someplace else, the hospital-based clinic can charge you the facility fee on top of it. So we see a lot of variation in the prices that people are getting charged. And as you said, they all come back to the consumer because that's what determines the cost of premiums, is how much care and the prices of the care that everyone's using.
You know, Representative Porter, I got to say, it reminds me of like you look at your cell phone bill, right? You look at the cell phone bill, it's got 50,000 fees. You know, the fees sometimes are more expensive than your line charge. I just wish someone could say and look that the little guy is having such a hard time. Someone's got to be looking out for us saying, guys, come on, enough is enough. We got to get through this, and we can't get through it if everyone's trying to make a big buck.
Yeah, no, I absolutely agree. And I think what's particularly interesting here is, you know, the mention of a facility fee. This was a pop-up tent. She literally drove through. She never even got out of her car. So we all understand that providers are having difficulty making ends meet. There's fewer elective procedures. Things have been delayed. But that's exactly why Congress provided that funding. We were not providing a license to make up and double or quadruple resources by overcharging for COVID testing. And I think there are really important lessons here for how we think about the COVID vaccine that we all hope will be safe and effective and available soon. We should not follow the same model we have with testing because we're going to have the exact same problems of people getting billed, people getting insurance, providers charging exorbitant amounts to provide a vaccine. We need to use a public health type model to solve a public health type problem.
100%. And Representative Porter, thank you so much for joining us. Thank you for fighting. Please, for the everyday guy, we need you, so keep fighting for us. And Matt, thanks for all your insight.
Thank you.